We're going to talk about some of the initial considerations with someone who has lateral elbow pain or tennis elbow. So starting off, just so we're clear on where this pain's coming from, typically it's going to be something that radiates up the back of your forearm, more noticeably coming back into the side. So if you feel the big bone on the back of your elbow, it's going to be off to the side of that, somewhere in this little corner. Usually, as I come up here, I'm going to feel a little bone that's going to be my radial head coming back through here, and then coming up to that, you feel another bone, which is the outside part of your humerus, which is usually tender or sensitive. Now, most people initially want to really stretch the life out of this. Sometimes that helps, but a lot of times the reason this is occurring, right, is that as I'm doing repetitive movements with my hand or wrist, if this muscle is not strong enough or up for the challenge of me doing what I'm asking it to do, it starts to pull at that tendon, almost like that tendon just wants to rip right away from its attachment, which is rare and very unlikely. But instead of that tendon ripping away, it starts to get agitated right where it attaches to the bone, and that's typically the source of that pain. People go right along that bony prominence in order to be sore. So a couple things that you want to start off with to try and alleviate that pain. Ice is definitely one of those things. Another thing is obviously trying to decrease how much you're irritating that tendon. So if you have an activity that's repetitively making this sore, ideally you would start to do that a little more with your other hand, or you would try to minimize how much you have to do that. Now, from a movement perspective, one of the first things I like to give people to do is actually just to come right down from where that pain is, right, and to directly strum across right below where that tendon is painful. So usually part of the issue is that these tendons don't have a great blood supply. So as they get trauma or repetitive strain, they don't heal well on their own. And even after the inflammation calms down, they're left a little bit weakened and a little bit more vulnerable to even being aggravated again in the future. So this digging across, I basically take the points of my fingers and I just strum across here. It tries to promote blood flow, and it tries to take that weakened tissue and promote a change that makes it stronger and more durable. So like I said, I wouldn't necessarily push right on the tender spot. I would get just down below it. And if it does give you any soreness, I would ice right after. Okay, now next on the list is going to be something to move this area. So rather than holding a strong stretch, I like to have people start off just pumping in and out. So that I'm tugging at that spot, but I'm not pulling so hard that I'm just replicating pain here. So just a light movement in and out, as opposed to holding a static stretch. And these are things that you can do even lightly throughout the day. Another position that I'll give people to do so it pulls even all the way up the shoulder, is I'll have them hold something, say a pillowcase. So they'll do the same motion of flexing the wrist, and then they'll extend all the way at the shoulder. So even though the problem is here, typically there's other issues in your arm, whether it's weakness in your shoulder that's leaving this to have too much pressure on it. Most upper extremity tasks that I do involve my whole arm, right? So as I'm screwing a screwdriver or picking things up, it's not just this muscle that's doing it. Part of it can be that this is a little bit weak and it's not up for what I'm asking it to do. Another part could be that I have weakness further up the chain in my shoulder that's putting more pressure on this area than it should. Rather than my shoulder helps screw that screwdriver, if this gets tired, fatigued, or weak, now there's more stress on my forearm to do it, and now this gets agitated. So strumming across it, 5 to 10 minutes. If it's sore at all, icing after. A very light pulsing in and out of a stretch, either here or grabbing a pillowcase where I'll flex my wrist and reach back in and out, which will pull on the whole system. And then I'll usually start doing things rather than activating this area, actually start off by activating my triceps. So I may actually grab like a band and do some pulling down this way. I may do even just a press down into a counter or surface. Same thing, this will engage more of the other side and take some pressure off the spot. So some initial considerations with tennis elbow. There's definitely more activities that we can do to strengthen and make this area better. But early on, those are the things that I would go to, as well as possibly some kinesio taping, which you may also see in some upcoming videos.